So tell us about the sinuses. Do we have, how many do we have? What's their job?
Sure. So there are two pairs of sinuses, one on each side.
Okay.
They're known as the frontal sinus, which is the sinus on your forehead, the ethmoid sinuses, which are in between your eyes, your maxillary sinuses, which are at the level of your cheeks, and then in the back of your nose, they're known as the sphenoid sinuses.
Okay. And what organs get inflamed when we have problems here?
So many times when the nose gets congested or inflamed, that leads to obstruction of the drainage area of those sinuses, and so the sinuses can't release mucus and backed up fluid, and then that in turn leads to a sinus infection.
Okay, so sinusitis, itis, that's when something gets inflamed.
Correct.
Okay, and is it the same as a healthy sinus, sinusitis, sinus? What's going on here?
So the healthy sinus is red or clear, and that's the sinuses are supposed to be clear or full of air. They're not supposed to contain mucus or fluid within them. The sinusitis, the one with the chronic infection or infection in the sinus, has, as you can see, a layer of either fluid, mucus, or pus inside that sinus, which then allows for bacteria and other organisms to grow, producing infection.
So how long does it usually last?
So that depends. We have definitions for the length of sinusitis.
Okay.
So an acute sinusitis, generally less than 4 weeks, but more than 7 to 10 days. And then if you have chronic sinusitis, we define that as usually more than 12 weeks of a medical condition that falls under a sinus infection.